You are probably asking yourself many questions when it comes to choosing the right prescription drug plan. In today's video, I'm going to walk you through exactly how drug plans work, the 4 stages of drug plans, and all the different moving parts of drug plan coverage, so you're empowered to be able to make the right choice for yourself, and also to understand when moving through enrolling into a drug plan and then beyond, exactly what to look for when you're choosing prescriptions, and also about generics, name brands, costs, what you're going to be sharing those costs if you're taking a heavy amount of medication, how to lower the cost, how to be aware of how your drug plan can benefit you and save you money. Guys, be back in a second and we'll talk about the in-depth details of prescription drug coverage with you today. I am back. My name is Kelpie Hightower with Medicare Hub, and I'm going to walk you through exactly what you need to know about prescription drug coverage, how all Medicare prescription drug plans work, if they're in a Medicare Advantage plan, which we call Advantage prescription drug plan, or an MAPD plan. If you're on a standalone Medicare supplement and in picking up a Medicare prescription drug plan, exactly how do these prescription drug plan coverages work, things that you need to be aware of, the penalties, access to care when it comes to coverage and things like that. What do you need to do if certain situations come up with your drug coverage, what the doctor needs to be aware of, or what the doctor is required to do. And then lastly, your exposure, the cost. What is it going to cost me if I go into a drug plan? What is it going to cost me if I choose not to go on a drug plan? So a couple things about the 4 stages of drug coverage. Every prescription drug plan has 4 stages in it. And the initial stage is the deductible stage. Some plans, as you see here, can have a deductible stage. Right now, this year, the deductible has been raised about $40. And each year, the deductible usually increases a little bit. So we usually like to say that the cost of living adjustment can adjust your Part B premium. It also can increase the Part A and Part B deductibles. And typically, it's going to increase the Part D, the drug benefit deductible. Now, not all drug plans have a deductible. So when you're talking to someone, they need to be aware of what they're doing to explain if that plan does have a deductible that you have to meet for any of the tier drugs that we'll talk about here in a few minutes, or if it just applies towards the name brand drug. That's very important to know, to understand exactly what am I going to pay out of pocket first. So a deductible means you meet the deductible first, and then the second stage occurs, which is the initial coverage election. This is going to be where you participate in a small copay or co-insurance amount. Typically, I like to say you're going to pay this, the health plan is going to pay this, the combined total is the total cost of the drug. So your copay amount is going to be determined by the tier that it's on, that we're going to cover here in a second, explaining the different tiers on prescription drug plans when it comes to choosing a health plan option or a drug coverage plan is going to meet your needs. Now, the third stage is what's called as the donut hole. A lot of times, historically, it's been called or referred to as the donut hole, or in Medicare's, vernacular is going to be called the coverage gap. And so what happens in the coverage gap is what you've paid from the beginning of the year, your true out-of-pocket cost. If that reaches $5,030, you're going to go into this phase called the coverage gap. And during the coverage gap, you're going to pay 25% of the allocated costs that's contracted with that prescription drug plan. Now, each drug plan, each carrier that has a drug plan, they contract out with the pharmaceutical company. So one pharmaceutical company and drug plan may have a contract for $1,000 for a medication, or $100 for a medication, or $20 for a medication. Another plan with those same medications may have a variance of $100, $200, or the generics may be only $15. So it's going to change the cost of what you're going to incur during each stage, but especially in the third stage of the donut hole. So during the donut hole, this is for people a lot of times that have name brand medications, you're insulin driven, you're taking high cost drugs, and the total cost that you paid out of pocket, including the deductible in the first 2 stages, the initial coverage election, or coverage stage, you're going to be paying money out of pocket. And if your total cost reaches this $5,030 this year, that number can change. You need to be aware of what the numbers are each year. You're going to go into the coverage gap, and you're going to begin to pay 25% in this coverage gap. And I'm going to show you a slide here in a second that kind of goes back over exactly what I'm saying to you right now. So just be patient with me just for a second. I'm going to show you an additional slide that will help you understand exactly your cost when going through these stages. Stage 4, how we get into stage 4 is what you have paid, including what you pay in 25% cost in the stage 3, the donut hole. If that reaches $8,040, your total out-of-pocket cost then is going to push you into the catastrophic. And then I like to say simply everything drops down to zero or a very small cost or a 5% cost of what that contracted drug price is with the prescription drug plan that you have. So this is an easier way to be able to look at the numbers. Just to understand, by looking at this slide, you're going to understand exactly what I said. So we're in the year 2024. So this is going to apply. These 4 stages have been around for several years now. This is going to apply in the future. This is going to apply in the past. The only difference that you're going to see each year in times past is these numbers that are down here at the bottom. The deductible right now is $545. Again, if your plan has a deductible, some plans do not. Medicare Advantage plans, a lot of times the prescription drug benefit does not have a deductible on it. So your agent needs to be aware of how the deductible works, because you could enroll into a plan, all of a sudden have coverage begin, and they not explain it correctly. When you go to get your medication filled, let's say your total cost out of pocket could be $227 for the first month. That means you're going to meet that $227, you're going to meet it again, and you're going to meet a portion of it again before your initial coverage stage begins, which is stage 2. So it's very important to be aware of how that deductible plays into your medication cost, and if it applies to generic, if it applies to name brand drugs. We're going to cover that here in a second as well. And then your initial coverage election or coverage stage, is $5,030. Again, that's what you pay and what the health plan pays. That's going to give you a total cost. If you reach this $5,030, it's going to push you into what we talked about as the coverage gap, the donut hole, and then what your true out-of-pocket cost has been from the beginning of the year. Everything runs from January to December 31st as a calendar year for Medicare prescription drug plans. So if your total out-of-pocket cost reaches $8,040, you're going to go into stage 4, which is the catastrophic, and everything's going to be 0 up to a 5% cost. Stay with me. We're going to be right back and cover some other important information. So just to make sure you're aware, in stage 3, which is called the donut hole or the coverage gap, you're going to be responsible for paying for this $8,040. So 25% of the cost of the medication in this stage is your responsibility. But stage 1, 2, and then going into 3, the total cost out of your pocket is going to equal this $8,040 that you're going to be responsible for. Now, great news. Most people, a lot of times, do not enter this donut hole or coverage gap stage. A lot of times you stay in stage 1. Honestly, most Medicare Advantage plans don't have a deductible. You'll actually stay in stage 2. You'll have small copays. You may have a name brand drug that you're paying a little bit larger copay for, but typically most people do not hit this stage unless they're chronically have a disease, illness, they're diabetics, they're insulin driven, they have cost of medications that are pretty high. Sometimes though, you may enroll, you may be on a name brand drug that Medicare does not have a generic equivalent for, or your drug plan doesn't have a generic equivalent for, and you can have a very high costing drug or a Part D injectable that can push up the price of what you're paying out of pocket. And guess what? If that occurs, you go into the donut hole, and this is important to know, and just understanding how the cost works. So if the cost of the drug is $1,000, 25% of that is $250 each time that you get that filled. So Medicare Part D penalty, if you choose not to enroll, we're going to cover exactly how to calculate your Part D penalty. Or if you've never chosen to enroll into a prescription drug plan, you're looking at choosing a drug plan to go into effect to cover some of the cost of your medication, you may be saying, what's it going to cost me? I heard that there's a penalty. If you'll give me just a second, we're going to come back and cover this with you. So how do you calculate your Part D penalty if you did not have drug coverage before, or you're aging into Medicare, you're coming off an employer plan, you're trying to juggle and say, hey, I'm healthy, I'm not taking any medication, I think I won't get a drug plan at all. How does that affect me? And usually I tell people, you're better off getting a drug plan, not paying the penalty, unless you have like TRICARE, or you have like VA benefits, or you have some means of having your medication costs lowered or covered. You're going to be, in a sense, up the creek without a paddle if you do get onto a name brand drug and then have to choose to go onto a drug plan and several months has passed because you're going to get penalized by the federal government. This has nothing to do with brokerages like us. It has nothing to do with the health plan that you choose, the prescription drug plan. This penalty is a penalty assessed by the federal government, and this is how the equation works. So it's one time the national base premium, which right now roughly is about $34.70. I usually like to say it's about a 35-cent a month penalty, times the number of uncovered months you didn't have a Part D or credible coverage. So that kind of equates out to 1% times the national premium average times how many months equals the penalty. Now, the problem with that is if you have 5 years of non-coverage for a drug plan, that is 60 months. 60 months times roughly this 35 cents is going to be a little over $18 in penalty. And typically that's going to be assessed to your Social Security. If your Part B premium is being drawn out through your Social Security check, typically this penalty will be assessed through your Social Security, or they're going to send you a bill and you're going to have to pay this penalty bill. I would encourage you guys to eliminate that by enrolling into a drug plan. If you have a Medicare supplement plan, there is a lot of drug plans that you can pick up for a low premium, even if you're not taking any medication. If you're choosing to enroll into a Medicare prescription drug plan, a Medicare Advantage plan with a drug benefit, I would encourage you guys to make sure that you get drug coverage on it so it eliminates this penalty. I'll be back in just a second. I'm going to cover some other important information about the 4 stages and your drug plan coverage. So what if you're losing credible coverage with an employer plan? How does that work when it comes to your drug plan benefits and understanding some of the rules and regulations around that? We're going to cover that now because it's very important for you to understand exactly where you stand when coming off a credible coverage plan with your employer. So loss of credible coverage, a person must not be without credible coverage for 63 days or more in a row, anytime after they were first eligible for Medicare drug coverage, to not be charged a late penalty. So 63 days is kind of this magic window. And so if you're coming off a credible coverage or employer-based plan, we typically encourage you 3 months prior, get in contact with an agency or someone like us to walk you through the steps of getting enrolled into your Part B, being prepared, having your A, your B ready, and then going ahead and choosing a health plan. And then as soon as your credible coverage ends, this new health plan is going to begin, which would include your drug benefit if you so choose to choose a drug plan, which we would encourage you to do so. And it eliminates this 63-day window that can get you into what I call a penalty zone. So if you go beyond 63 days, even though there's all these rules and regulations around dropping credible coverage, you have 8 months to enroll into Part B of Medicare. You actually have 8 months to enroll into a Part D plan. But if you surpass or go past the 63 days, you're assessing a penalty per month, again, about 35 cents a month for however many months you did not have a credible drug plan and show credible coverage when it comes to drug benefits. So I encourage you guys to not have that happen to you. So if you're searching online, a lot of times you'll read Medicare make this statement that enrolling into your Medicare Part B needs to be done 1 month prior to your employer plan stopping. In essence, if you try to wait to the last month, you're going to find that a lot of times that the Social Security office that's processing your application to go on your Medicare Part B, which we would consider, it's called the 40B form. If you're going to have that submitted, I would do that 3 months prior. Give yourself enough window to have Part A, Part B, and then we're going to help you choose the plan that's best for you when it comes to your Medicare supplement, Medicare Advantage. And then if you need a drug plan, we can help you choose that. You have this larger window to enroll, so when your employer plan cuts off, you're not being held up with your health care coverage. Now, I just want to remind you guys, you can actually grab a how to enroll into Medicare guide below. If you're new to Medicare and you're turning 65, if you're coming off an employer-based plan, this is a great guidebook that you can grab. It's a free guidebook and it provides you the step-by-step guide. Or if you want to be able to call our office, you can call our office. We can actually handhold you through the process as well. So let's dive into formularies. Medicare has this huge list of approved medications or a formulary. And Medicare's huge list of medications allows the health plan itself, or the prescription drug plan that you're looking at, to be able to choose from Medicare's large list to pull into their formulary. Now, we'll dive into a little bit more details about the formulary, but one of the main things to understand about the formulary is there are going to be FDA approved drugs and Medicare approved drugs on the huge list of Medicare's approved list. And a lot of times people say, well, how many drugs are on that list? Well, there's thousands of drugs. When they pull into a formulary, they have to have at least 2 medications per category to have it approved for Medicare. So that means for an insulin-based drug, there has to be at least 2 insulins per category of insulins in the insulin category. If there's anticonvulsants, seizure medications, there has to be at least 2 medications in that category to allow it to be an approved formulary when it comes to what CMS deems as an approved list. So we're going to cover drug tiers here in just a second, which is very important on the cost breakout of what you're going to pay. Stick around, we'll be right back. So drug tiers, how do drug tiers work? Well, they're pretty simple in that there's a list of medications that have a cost associated with them based on the tier that they're on. Now, most drug formularies are going to have anywhere from 4, 5, or 6 tiers. Most of them will have 5 tiers. Tier 1 and Tier 2 typically are going to be brand name generics, what I call the lowest cost generic. Generic medication, Tier 2, which is a little bit higher cost. Tier 3 typically are brand name drugs. So that's going to be like the doctor prescribed 10 years ago. It was a name brand drug and you've been on that drug and now you're going on to Medicare. A lot of times that drug is actually going to be associated with a Tier 1 or Tier 2 generic, which is good news for you because it lowers the cost of the medication. Tier 4 drugs typically are going to be non-preferred drugs. They're going to be a higher cost copay or co-insurance, and they're going to have a higher cost to them. And then there's going to be Tier 5, non-preferred or they basically have this category where they're not going to prescribe it unless there's nothing else available to solve the health condition that you have. So that's going to be a higher cost copay or percentage. Usually it's about 33% of the cost of the medication. And then some drug plans will have what they call selective drugs. They're going to be baseline drugs like maintenance medications. And a lot of times those plans will have those on a 6-tier drug at 0 cost. So they want you to be able to take the medication to help maintain maybe a high blood pressure, high cholesterol, maybe some maintenance medication associated with those 2 items or other things. Those drugs typically are going to be 0, or there's some specialty tier that they allocated into the formulary to have a tier that has a lower cost, and that the incentive of that is for you to take the medication. The important thing for you to remember is when you're choosing a drug plan or you're choosing a Medicare Advantage plan, you need to look at your medication and what tiers they are, and if the agent knows what they're doing, they're going to go over this with you correctly. And their responsibility, or like our responsibility, would be getting you into a drug plan that has most of your medications into a Tier 1 or Tier 2, or the Tier 3 would be at the lowest cost. So drug plans, you could be on drug plan A, and the total cost of your copays and co-insurance a month could be $150. Or you could be on plan B, and the total cost of your copays and co-insurance could be $75. That's a huge difference, and it's very important to understand how to shop or look at those options and having somebody guide you through that properly. So one of the most important things to understand is if your drug plan doesn't cover your medication, there are medications that people take that Medicare doesn't approve. You may have to get what's called a prior authorization, or the doctor needs to prescribe a medication after you're on the drug plan. Let's say you go into a drug plan and it starts January the 1st, and all of a sudden halfway through the year, your doctor says, hey, you have this condition, this is the drug I need to prescribe. You find out that your drug plan doesn't cover that on the formulary. So the doctor is going to authorize or send in a prior authorization to the health plan, explaining to them what you need to take, the reason why, and what problem it's really going to solve. Those really are kind of the 3 things that they're looking for, and they're going to send that in on a prior authorization. Now, sometimes the health plan will deny that. The doctor again, or you, is going to resubmit and ask to eliminate the denial to put the drug onto the formulary. Now, I like to give this simple example. Each time that you appeal, it gets closer and closer to Medicare's desk. And Medicare, if it falls on their desk because the health plan will not do the right thing when it comes to your needs for a medication being placed on a formulary, unless it's a risk drug where it's just not FDA safe, or Medicare approved drug where it's just not a healthy drug. If it's on Medicare's big list of approved medications, Medicare will require that health plan at some given point to approve it. Now, star ratings, for you guys that are understanding star ratings for health plans, they rate them on a 0 or 1 to 5 stars. The higher the stars, the more money they receive to help provide better benefits, copay costs, savings, and additional things like that. It's this whole matrix of the 5-star rating. Well, the impact that it has if they deny, and it hits Medicare's desk, and Medicare comes back and puts some weight on the health plan to have it approved, it affects their star rating. So the great news is, if you're having to do an authorization, a prior authorization to get on the medication, typically it's not going to hit Medicare's desk. You just may have to do those steps a couple of times, and the doctor is going to be a part of that. You need to ask the doctor for help, or like if we're the agency that's helping you enroll, guess what? Pick the phone up, call our customer service line, get in touch with us. We can walk you through the steps to be able to help that process and make sure that you have somebody helping you when it comes to walking through this process called prior authorization. All right, guys, lastly, I want to cover quantity limits. So you may be on medication that only allows you to be able to fill up to a certain amount of medication per month. A lot of times this is associated with a high-risk drug, or if it's pain management type of medication, you may be on a pain medication that only provides you up to 60 or 90 or 120 pills a month. And then some of you guys may have to go back to see the doctor on a monthly basis or every 3 months to have that extended out, or what I call the refills, to be allocated at the pharmacy and allow you to be able to go in there and get the refill. You have to go back in and get the authorization from the doctor. Pain medications can be set like this, and you're set on a certain quantity limits, and you may have refills that are going to last for a year, but you can't get the refills unless you go back to the doctor. So when you're enrolling into a prescription drug plan or a Medicare Advantage plan with a drug benefit, you need to be able to understand that sometimes medications have quantity limits, or what's going to be notated on there is QL, and to read about the evidence coverage, or what does that mean when it comes to quantity limits. Now, typically we explain that to our clientele so they understand when they're enrolling. They're going to get their medications filled. They may have questions about that. They need to understand exactly, what does this mean when I have quantity limits? How does this affect me? And then how often can I get the medication? And then if you think you need to be taking 3 pills a day, but the doctor says 2 pills a day, and they allocate the quantity limits at a lesser amount, then you're going to be strapped to be able to get that medication filled every 30 or 31 days based on what the doctor's interpretation of prescribing for that particular illness or sickness or whatever's going on in your life. Medication will have quantity limits. You just need to be aware of them. So I've just covered exactly what you need to know to be able to enroll into a drug plan, understand the different stages, the different limitations, why there's different costs, the formularies, what all that matters and means to you when choosing a prescription drug plan. One of the things I would encourage you guys to do, if you have not and you are enrolling into Medicare and you're going through those steps, is either to get our guidebook, or guys, give us a call. One of the things that we do, we're an independent insurance brokerage that specializes in Medicare health plans. We'd love to be able to walk you through every detail that we just covered to ensure that your medications are put into a software platform that we can actually look specifically based on your needs, your questions, your concerns, choosing a drug plan that's specifically designed for you, that'll cover you at the lowest cost. If you need some help, give us a call. We'd love to be able to help you. Until next time, we'll see you on the other side.